Adam Bounce, 41, experienced vomiting and a headache after suffering a severe and rare reaction to the jab. His father eventually called for an ambulance when Adam described his pain score as 10 out of 10 and he was rushed to hospital. The keen footballer underwent a CT scan which revealed an acute right frontal lobe hemorrhage, which caused compression of the brain stem, and he was transferred to Derriford Hospital in Plymouth, Devon, for neurosurgery. However, during the operation, which noted that his brain had become very swollen and very tense, the surgeon found there was no improvement, despite the removal of the blood. A decision was then taken by the neurosurgeon not to continue with the craniotomy further due to futility as to the appearance of the very swollen and very tense brain, and the absence of response to the haematoma. Evacuation was associated with a negligible chance of survival and recovery. A cause of death was given as intracerebral haemorrhage, operated, reports. And, giving a narrative verdict at the Plymouth inquest yesterday, senior coroner Ian Arrow said, on the balance of probabilities this created a vaccine-induced thrombocytopenia that led to Adam having a low platelet count, making him vulnerable to hemorrhage. He was given platelets but sadly succumbed to a hemorrhage. Adam, a financial sales manager, had received the vaccination 11 days before his death on May 31. The dad, from Axminster, Devon, first thought he had food poisoning after feeling unwell following a barbecue earlier that month. But the inquest heard Adam's condition worsened to the point where he could not stand properly and was floppy with no strength in his arms or legs. He vomited repeatedly before he was dashed to A&E. Dr Adity Shivane, consultant neuropathologist, carried out an post-mortem examination at Derriford Hospital and found a massive intracerebral bleed. In attempting to find the cause, he could not find a tumor or cancer which could have caused such a large bleed. A toxicological examination was inconclusive. He said there was no evidence of a trauma or injury and was, on the balance of probability, a spontaneous bleed. In addition, he said there was no evidence of a heart attack, but he did note hemorrhaging in the right kidney and blood clots in the mesentery, a membrane attached to the abdominal wall. Dr. Wayne Thomas, a consultant hematologist at Derriford Hospital, also gave evidence to the inquest which noted that tests of Adam's blood found a marked reduction of platelet count and that a low platelet count gave a tendency to bleed. He noted that in someone who was well, the low count could be related to their immune system, which then attacks platelets and reduces them. He said that in patients presenting with immune-driven low platelet counts that they do suffer spontaneous bleeding such as within the brain, which could lead to death. Dr. Thomas said that platelets derived from donors were given to the man to try and correct the low platelet count, but if the immune system was already attacking platelets it may also attack the new donated platelets. Dr. Thomas said that the question of whether anything else could contribute to the immune system activating itself, before explaining that as we are all acutely aware under the situation with COVID infection we have subsequently become aware of vaccine-associated changes within our blood clotting system. He said tests submitted found the associated antibody which causes low platelets. He said, "We know from studies that this is very rare. There has only been about 260 cases described in the UK and we know that in the situation of patients who present with bleeding at the time of presentation that the mortality is around 0 to 5%. Adam's brother paid tribute to him on behalf of his whole family. He said, "Adam was a much-loved member of our family, and the local community. He leaves behind his son Owen, father Les and brother Jamie. In shock at the outcome of the inquest, will be greatly missed. He was the life and soul of the party, and certainly made the most of his 41 years.